My name is Caruba, and I report on health and medicine for the San Antonio Express News. It's been a long year for sure, but this entire past year, my focus has really just been informing the community and really just like focusing in on how is this affecting the community. As many numbers as there are, with the pandemic, I've just really tried to focus on the human toll aspect, both with the virus, how is this affecting patients, how is this affecting doctors and people in hospitals, and then with the freeze, how is this affecting those same folks, how is this affecting dialysis patients. And so my whole goal is to really tell the story of this crisis through people and their individual stories. And when you're talking about hospitals and healthcare systems, what you're really talking about is people. You're talking about the patients who are affected, and you're talking about the people who are caring for them. The nurses and the respiratory therapists and the doctors who are also having to navigate this like completely new situation that also poses a risk to their own livelihoods. And so if you think of it that way, it's really just about the people who are operating within a system and who are affected. I think the story that really resonated the most with people was a story that I published right as the first surge in San Antonio was getting underway. And myself and one of our staff photographers, Bob Owen, we embedded in one COVID ICU for 18 hours. And we really saw what it took to care for these really critically ill patients up close. We saw the amount of time they were spending taking on and putting off PPE. We saw how it had completely changed their workplace. The people who worked with COVID patients wore different color scrubs than the other nurses to kind of indicate that they were in the hot zone. They were dealing with family members coming in and saying goodbye through a pane of glass. We were actually there when a family came in and did that really painful final goodbye to a patient who it looked like wasn't going to make it. And so we really saw what the pandemic is doing and the consequences of this virus on our healthcare system. And we were able to do that by spending a really long time with that unit and getting to know the nurses and gaining their trust so that we could tell the story of this pandemic. We can do a lot of reporting, reconstructing things that happened by doing a lot of in-depth interviews with people about their own experiences, what they saw, what they heard. But at a certain point, you can never replicate observational reporting, which is going and seeing something yourself and taking notes and taking pictures and taking video and really truly understanding what's going on. There are just certain things that as reporters, we have to go out and be the eyes and ears for the community and try to provide as accurate a picture and really put the readers in the moment for what we saw. To do my job effectively, I really have to put myself in the shoes of the people whose stories I'm telling. And so that's a lot of emotional burden. At the same time, those are the stories that really matter. And those are the stories that our community needs to know. And this is like the history that we need to document and to preserve so that people know how devastating this was. Every single day of this pandemic, I have woke up and tried to work for the community. I've really thrown my whole self into telling the stories of patients and families and people who have been affected by this really devastating illness. And I just want people to know that journalists are people too. We both are reporting on this pandemic, but we're also living through it. We're also getting sick from this virus. We're also having family members get sick and in some cases die from COVID. And so we are trying to juggle our professional responsibilities of getting the word out to the community and getting the information that the community needs while also having to live this ourselves. And so when you think about journalism and what folks are doing, pretty much every day, day in and out, we're doing the best that we can to provide the best information that we can to the community. I feel like the Express News is the voice of San Antonio because we live and work in this community just like everybody else. We see what's happening in our own neighborhoods. We see what's happening with our friends and family members. We work together on a daily basis to try to make sure that we are telling the stories in as full of an accurate picture as possible. And we work together collaboratively to bring all of that journalism to folks. And so when we're covering San Antonio, we're also like living and breathing San Antonio too. We live in the community just like everybody else.